Hi, my name is Dr. Bonnie Key, and I'm the Editor-in-Chief of JACC CardioOncology. I have the great pleasure today of sitting down with Dr. Sherry Ann Brown, who is a physician scientist in cardio-oncology and is very active on social media. Sherry, thanks so much for all your efforts in cardio-oncology on social media. It's been really terrific, and I think all of your work has really helped to motivate a group out there and really helped to inspire them. I wanted to sit down today, though, and talk with you and just get your perspective on social media, particularly as it relates to medicine and clinical care. What do you think, or how do you think social media can really help to further science and clinical medicine?
Thank you for having me, Bonnie. I think that social media has tremendous potential to help us in our efforts at advancing science and medicine, particularly in cardio-oncology. One of the biggest things on social media is raising awareness of issues that are important to us. And in cardiology, most of us use social media professionally rather than for personal means. And so for us, the thought is to raise awareness of cardio-oncology to help people understand what it really is, why we care about it, and what we can do about it. And that's for both healthcare professionals and patients, because both populations come looking for information. And so it's great too for advocating for those needs we have in cardio-oncology, whether it's for education, patient care, research. And with education, it helps when we get to share information from conferences such as ACC or other big societies, because we're learning a lot in cardio-oncology. And it's really great to be able to share that information and build community.
Great point, definitely. What do you think makes an impactful tweet? I'm just curious in terms of really engaging the community. What are the contents of a tweet that makes it really draws in attention?
That's a great question. One of the biggest things in our field, in our community for cardio-oncology, is using the hashtags. And so hashtag CardioOnc or hashtag CardioOncology, that's what people will look for when they're trying to find information. So definitely including that. Very often it helps to have a picture or a video, something that visually captures the attention and gives you a sense of what you're looking at.
Yeah.
Having a link always helps, and making the link shorter using bit.ly or tiny URL or other means is also helpful. And tagging people in the tweet that you know might find it useful helps to disseminate the information and get it to who you really want to see it. And then of course, making a point in the tweet, whether it's a tip or information or an event, making sure you're getting some information out there that people can do something about.
That's a great point. Any dangers, any potential dangers here in social media that
Absolutely.
we should be concerned about or just aware of?
We need to recognize that everything we put on any form of social media is public and permanent. And we need to recognize too that in our field, we want to have professionalism. So we must always be professional, always be thoughtful, always be kind, and recognize that we're all in this together. And if we're interacting with healthcare professionals or patients, we need to be careful that everyone knows we're not giving medical information to be acted on for a particular patient. But if patients have needs that they bring to us, we can refer them to the appropriate resources.
Yeah, so the golden rule, right? And the knowledge may not be generalizable, but each individual patient needs to be brought attention to. Well, thanks so much, Sherry Ann, for sitting down with me.
Thanks for having me.